the Ministry of Health, and then by way of introduction, so it is by Section 102 and Section 109 of the Constitution of the State Portfolio Committee. And then our standing orders also, standing order 85 also established this portfolio committee. So it is well suited by law, and then it is responsible of performing oversight over the Ministry of Health, its department and agencies, and also other portfolio ministries and department under the portfolio committee, that is disaster and DMA, then you have refugees, and then humanitarian relief aspects. So our position as far as this issue is concerned is just to call on you, hear from you, as far as you are the executive responsible of administering or managing the affairs of public health officers as far as your association is concerned. So we want to hear from you, what is your stake on this, what resulted to the suspension of 371 public health officers, and what is the way forward, as you may put. And also, as I told you, we previously had a meeting with the ministry, and then they have been informed about this. It has been going and coming, and definitely it is unfortunate, I can say, but the minister, and then you are all under the ministry, you are all staff of the Ministry of Health, if I can understand. Probably some of you are not staff, but like the minister is responsible of, you are all responsible, by the minister is responsible of all of you. He is responsible of administering the health policy to you, and likewise the general orders of the Gambia to you people. So you are all answerable to him per se. So it is definitely very, very important that we all speak the same language from the ministry level, that is to your association, because as an oversight committee responsible of following oversight over the Ministry of Health, our interest is for the Gambian people. Whatever that affects the Gambian people, that's our interest. And then we have seen that services have been affected here and there, and then because we are also citizens of this nation, we also represent people. We are also from various constituencies. We are seeing what is going on. So we deem it necessary and befitting to invite you, hear from you, and then we pave a way forward, and then we see how best we can find a solution to this. So in essence, that's why we call you. Feel free, and then we just want to let you know, as procedure dictates here in the National Assembly, if you are speaking before the National Assembly Committee, it is by law that you take oath, because anything that you say here, it must be something true and nothing but the truth. Because we don't deal with speculations, we don't deal with accusations here and there, we only deal with facts, and these facts must be established by law, and then must be established by our own procedure too, because our procedures are also based on law. So in a sense, if anybody is about to speak, I will ask the secretary to please help administer the oaths, or you affirm, or anyhow you deem fitting for you, because people have different beliefs and religion. But at the end of the day, what we want is the truth and nothing but the truth. How things unfold until where we are. And then just to let you know, we are definitely constrained by time, because this is an afternoon meeting. We were supposed to have it in the morning, but all the committee rooms were engaged. So in essence, definitely, I think Secretary was just informed me, we only have 1 hour span. We started at 2:15, so the meeting essentially is to stop around 3:15. So thank you very much.
Why not the whole
affirm at the same time? Okay. We can also do, that's also a procedure. So we can all affirm at the same time, so that if you want to speak at any time, you are free to speak. But we don't allow you to speak to the committee when you don't take the affirmation. Thank you very much. You can just read.
I know how to like this.
No, the right hand, the right hand. Yes.
Okay. I know how to do hereby affirm that I will speak the truth, the whole truth, nothing but the truth. So help me, Allah.
Thank you.
I am Tasawwur, do hereby affirm that I will speak the truth, the whole truth, and nothing but the truth. So help me, Allah.
Thank you.
I am Kamara, do hereby affirm that I will speak the truth, the whole truth, nothing but the truth. So help me, Allah.
I, Brother Howard, I do hereby affirm that I will speak the truth, the whole truth, nothing but the truth. I don't know either. You hear my account that I was speaking truth, the whole truth, nothing but the truth, so don't hear about. I got me down. I do have a founder that I was speaking truth, nothing but the whole truth. So
Yes, that is it. Thank you very much, and then we wish you good luck. We wish you all the best. And then, just as a matter of information, the proceedings are recorded by our IT department, that is the Media and Communication Department, and it will be broadcasted live. I don't know whether they are live right now, but if it is not live right now, it will be broadcasted at a later date. They will do it. Now they are doing the recording. They will broadcast this at a later date. It's live right now. Good. Thank you very much. So that is it. So now I will hand the baton back to you. As I introduced earlier, we definitely have to be very much conscious of time. Let us get the best out of this meeting so that we can come out with something that is very, very fruitful and very positive. So thank you very much. So I will hand over back to the President. Thank you.
Okay, thank you so much, honorable members. So just to give a rundown from the day this particular struggle started to date. So in early 2021, we wake up to the news that the Minister of Health is about to implement or initiate allowances for medical doctors and PhD holders within the Ministry of Health. And the Ministry of Health comprises of various cadres. You have medical doctors, you have nurses, public officers, pharmacists, lab scientists, etc. So after receiving that news, the association in 2021 called their sister cadre organizations, the nurses and pharmacists. Yeah, so some of the cadres didn't have an association. So the three associations, public health, nurses, and pharmacists, decided to write to the authorities to make sure that particular decision is being reversed. So along the line, the nurses decided to separate themselves from the two other cadres. They decided to move alone, and public officers join hands with the Pharmacists Association. And on the 2nd of March, 2021, that was during the previous executive. For us, we came in January. So the previous executive in March 2021 wrote to the Secretary General and Head of Civil Service, putting to them some recommendations regarding the initiative that they're about to undertake. And one of them was to immediately suspend, allocating allowances for just a handful of people within the Ministry of Health, leaving out the others, because we think it is not befitting. So another recommendation was that the allowances that was created should be used to employ health laborers and other needed human resource within the Ministry of Health, because we work at the health facility. We know the working conditions. We know the need of some particular cadres. So that was among the recommendations that we put to them. And the other recommendation we also put to them is that if at all they are to go ahead with the payment or with the allocation of these said allowances, it should be across the board and not only handpick a particular cadre that will be benefiting, because Ministry of Health, for it to move, it can be carried out by just one cadre. It's a collective, responsibility. So after this particular letter, the association started consultations with the concerned authorities. That's Ministry of Health, Personnel Management Office, and the Secretary General and Head of Civil Service regarding this particular issue. So, along the line, we later on, in September to be precise, we learned that nurses started receiving the said allowances in September of 2021. So the association again wrote to them, wrote to the competent authorities, requesting for an explanation. So on the 6th of October 2021, a letter was written by one Amadou Dabo on behalf of the Permanent Secretary, Minister of Health, which was addressed to the Vice President of our association, wherein it was clearly spelled out that the ministry is seriously working on paying equal allowances to these cadres, and it went further to state that calculations were already done. That was on the 6th of October 2021. So in January, in January 2022, this particular new executive were elected into office in January. So immediately, we know the cadre was being affected by a whole lot of issues. So we started engaging the authorities concerned to make sure the rest of the cadre actually starts benefiting. We had a meeting first with the Director of Public Health Services regarding the issue, and we were promised that the matter will be resolved. Later on, we had another meeting with the Permanent Secretary, Minister of Health, regarding this particular issue somewhere in February, and again, we were promised that something will be done about it. So we went until 24th of March. The association deemed it fitting to take another dimension, as far as ensuring the payment of these allowances are concerned. Rather than simply engaging on dialogue and exchange of letters, because we feel it is not bearing any fruit. So on the 24th of March, we wrote to the Secretary General and Head of Civil Service, and we copied Permanent Secretary, Minister of Health, Permanent Secretary, Personal Management Office. 2022. 22, yes, exactly. Yes. So we put to them, the letter is a very long letter, but we cited the various importances of public health, here and there. And we went further to tell them that if the allowance issue is not been resolved before the 5th of April, 2022, public health officers across the country will lay down their tools and cease reporting to work. So we gave them on the 5th of April. So before the 5th of April, we were invited to a meeting by the Permanent Secretary, Minister of Health, wherein we were informed, or we were promised, that efforts are ongoing, to make sure this thing is being resolved. So they requested if we can forego the sit-down strike and just wait on the processes to follow. But after consultation among the executive, we feel that it is long overdue to still keep on waiting. So we started the first sit-down strike on the 6th, on the 6th of April, 2022. So during the sit-down strike, we were called by the Minister of Health, again requesting from us to go back to work because efforts are ongoing to make sure the said allowances have been paid. But after that meeting, we were not very comfortable with the promise that was given, by the minister. So we decided to go ahead with the sit-down strike. A few days later, we were called for a meeting by the Head of Civil Service, Secretary General and Head of Civil Service. By then, it was Noah Toure. So we have a very lengthy meeting with him, and in that meeting, he promised us verbally that these allowances will be paid, preferably by end of May. So after that meeting, the executive decided to call for an emergency congress. And the emergency congress, at the emergency congress, we put to the general membership the promise that was given by the Secretary General and Head of Civil Service. But because of the, respect, for the office and all that, hoping that the allowances will be paid by end of May. So we convinced our people but our people demanded for a written document from the Secretary General and Head of Civil Service, promising that these allowances will be paid by end of May. So the Secretary General wrote to the association on the 8th of April, in which it was stated that these allowances will be paid by end of May. So it was a resolution passed during the Congress to go back to work, to report back to work. So in April, on the 12th of April, we resume work, and life goes on. So, but along the line, on the 17th of May, because April went until it ends and May begins, we didn't hear anything from them. They didn't call us for a meeting, neither send us any letter regarding the allowance. So on the 17th of May 2022, we wrote to the Secretary General again and Head of Civil Service. First, we requested for a meeting. So in case maybe if I told there are challenges that they were facing regarding the payment of the allowances, they could have, for them to call and sit with us so that we can also know what we can put to the general membership, because we have a resolution that was agreed on. That is, by the 31st of May, if the allowances are not being paid, we will commence the second phase of the sit-down strike. So in order to avert that, we wrote this letter to request for a meeting on the 17th, but we were never replied. And again, on the 25th of May, 2022, we again wrote to the Secretary General and Head of Civil Service again to remind them of the promise which was made to the category of staff that were affected due to the lack of payment of the allowances which other sister cadres benefited from. But sadly, again, this particular letter was never been replied by the Permanent Secretary and Head of Civil Service. So May ends, and the executive decided to call for an emergency executive meeting, and we agreed that if the allowances are not being paid again, we will go by the resolution that was agreed during the first Congress we had. And we started the second phase of the sit-down strike on the 4th of, we prepared a memo around the 1st or 2nd to our membership, telling them that if they didn't receive any notification regarding the payment of the allowances, they should stop reporting to work on the 4th of June. So on the 2nd of June, we were sent a letter that was written on behalf of the Chief of Staff, the new position created. It was written on behalf of the Chief of Staff, addressed to Permanent Secretary, Minister of Finance, in which they were requesting the Permanent Secretary, Minister of Finance, to work to make sure that these allowances are being paid, because there was a promise made to the people. So we believe that this letter was sent to us so that we will not go ahead with the sit-down strike. So despite receiving this letter, we decided to forge ahead and go on with the sit-down strike. So 2 days into the sit-down strike, we were called for a meeting at the Permanent Secretary, Head of Civil Service. But upon arrival at Banjul, we were told the meeting is rescheduled to the following day. So the following day, we were told it should hold at 10 a.m. So we were there before 10 a.m. And again, when it was time, we were told it has been rescheduled to 3 p.m. So we decided, we were given space to sit down and wait until 3 at the Ministry of Health. So when it was time for meeting, we marched together with the Permanent Secretary, Minister of Health, Director of Public Health Services, and other stakeholders to the Secretary General. Upon arrival, the executive were told that they are not part of the meeting. So we pack our bags, feeling so much disappointed and all that, and went back. So after that, we were never engaged again officially by neither the Minister of Health or the PMO or the Secretary General and Head of Civil Service. So in the second week, the elders, the senior political officers, decided to call for a meeting to find a way out, and we agreed to form a task force. Then that task force visited the minister to serve as, to mediate between the minister or the Minister of Health and the association or the executive. So during that meeting, or during that mediation meeting with the minister, they were told, according to them, that the minister said, for these allowances to be paid, it has to undergo due process. So the due process, they said, was it has to be endorsed by cabinet first, and later on to be endorsed again by the National Assembly for it to be something that will continue rather than just doing one-off payment. So after receiving that information, we sat over it, and we were not comfortable with it. So we went ahead with the sit-down strike, and later on we were invited by the minister himself for a meeting. We have a roundtable meeting with him, but it was the same thing that he told us again, that due process has to be followed. So we were surprised. Is it that since March of 2021, is it now that they are just realizing that these things should follow due process? So we were dumbfounded, and we weighed the cons and pros, and we decided to go ahead with the sit-down strike, because the reason for the second phase is to make sure the allowances have been paid. Now, hearing that there should be endorsements, which even one was not done, so to go back to work at that particular juncture, will raise a lot of eyebrows as far as the strike is concerned. But along the way, we later on received a letter from the permanent secretary to the executive requesting us to ask our members to report back to work. That was on the 27th. Okay, it was around the end of June. Yes, 28th of June. So we decided to go ahead. Then later on, we saw a press release, or sort of a warning that if we didn't report back to work, there could be negative consequences. So, following advice from our task force and some veteran public health officers, we decided to again call for an emergency congress on the 30th of June, where a good number of our members attended, and we were able to convince them, to report to work on the 4th, because we had the congress on Thursday. The 30th was on a Thursday, so we decided to report to work the following Monday, because some of our colleagues travel all the way from the region and they have to go back. So we gave them that grace period so that they can report back to their stations and start work on Monday. And we wrote a letter. We wrote a letter to the permanent secretary, Minister of Health, informing him of our decision to resume work on the 4th. That letter was sent to two of our senior public health officers. One of them served in the task force, for them to relay, or for them to submit the letter to the permanent secretary as they requested. So on Monday, we started work across the country. Public health services started across the country after a very long break. On Monday in the night, some of us were already on bed, and people like me, we started receiving calls about a particular letter which was addressed to the permanent secretary, indicating a suspension of 371 public health officers across the country. So we were dumbfounded again, citing the numerous efforts the executive have taken to make sure people report back to work, only to wake up to news that again, we have been suspended. So then after that, series of negotiations were done again. Yeah, it's okay.
No, you can carry on. I'm just signaling you.
Oh, okay. So then, despite being privy to that letter, we asked our people to continue working because we were promised here and there that maybe this one will be rescinded. So we advise our people to continue working until fourth, fifth, sixth. Nothing positive came in on the 7th. Nothing positive came in again. So after due consultation and from advice, then we later on advise our people to stay away from work and abide by the suspension. So after that, to date, another task force was created. This time around, we included senior public health officers, some of whom are fit to be our great-grandparents or grandfathers or so. And they met the minister to put to him the implications or the repercussions that this particular suspension can lead to, citing the fact that COVID is ongoing, and in fact it is on the increase according to the data, and having or receiving news of pocket outbreaks, in various countries, and other repercussions that the suspension can lead to. So they were told by the minister that for them to consider talking to the PMO to rescind the decision, they will require a letter of apology from the executive because according to them, they say they're not very happy with some of the words or sentences that we use in our letters. So we did that. We wrote that letter, and the letter was submitted to the Permanent Secretary, Minister of Health, and other dignitaries too were copied, like the chair of PSC and other stakeholders. So from then, we didn't receive any other news, or no other step has been taken as far as these suspension is concerned. So in short, that is what I thank you.
That's a marathon. Definitely a marathon. But thank you very much. I think we had you well. Yes. Thank you very much. I think that was a marathon, but definitely we had you well. The process have been ongoing according to your submission since 2021. So before I open the floor for members to come in, is there any other among your team who want to maybe shed more light on the issue, but not necessarily repeating what he already said? Yes. If there is none, I will invite the honorable members then to come. Yes. You came late and you missed. Give my sister the floor as
Okay. Swear. I don't know if I have the floor. How will you swear without the floor?
Go ahead. You want to come in?
No. Problems that the creation of allowance for a carer and leaving other carers. We are assured of calculations were being done for every other carer within the ministry to be benefiting. Was a significant turning point for public health officers and all other carers that were left out of the scheme to welcome and to be hopeful that the day of glory is not very far. And these cadres, these allowances that the Public Health Association is very much into is not limited to only public health officers, but other cadres aside from public, like the pharmacy and also the lab staffs. because the list that I participated in working out through involve other cadres, not only public officers. And second, I think the president have oversighted was when we had the first strike, and when the members agreed enormously within ourselves, there were a set of resolutions that were developed, and most of these resolutions were not honored by authorities. The payment was not made, and there was no communication as to the reason why the payment was not made. And when we wrote, because there was a change of cabinet, and we all believe that change of cabinet might have affected the process of what was going on, there were no communications, and I think that has impacted the duration of the strike. For the fact that first 2 weeks of the strike, there was no not engagement, and there was no notice. And one point also, I want to understand as a person or as a member of the association the reason for the suspension, because you are working with me to get my people back to work, and God willing that has happened, and the day that has happened or the day after that has happened, you saw me that I'm being suspended for another extra 2 weeks without any plan laid out. 2 months, sorry. I mean to say 2 months, without any plan that we might not see per se being put in place to supplement the lost duration, and also the added 2 months is scary to me, because we live in meningitis belt, we live in cholera belt. Currently, there is an outbreak of Marburg virus in Ghana, and we are cross border with Ghana. Like flight is coming and going out of Ghana every day. There is no outline plan to show surveillance and other important activities that public officers continue to take part. We had not directed to us that there is a purported plan for immunization of vaccine preventable diseases. But our understanding is that in public health, it takes you 3 years or more to be trained on immunization and immunology. But what plan is in place to cater for that training gap? And the people that will be involved in that, how qualified or how trained are they going to be within the short duration of time? Our fear and our worry is there could be a vaccine hesitancy. And what I mean by vaccine hesitancy, people might now be reluctant to bring their kids and their family for immunization, and that is going to affect the already established coverage of immunizations.
Yes, thank you very much. Thank you very much. And then I think that's I will allow members to come. And submission.
Yeah.
From the submission of the president and the chair, I think we are really taking a lot from that. And then at the end of the exercise, we will definitely want you to. I know you have written to the committee before, but it was never tabled. Like all the documents that you have in place, the correspond.
Qualified members of your association, or you have a list of people who are there and who are not. This, whatever I'm driving at, I want to know. You might know this, but the ministry also will answer to some of these things. But then, what is your overall membership? Thank you.
Yes, we can take another question.
Yes.
Okay, good morning. Good afternoon, rather. Mr. President, thank you so much for your explanation. We had it before giving you people the allowance, and week month or week year. And second, they say that I said I want to know about the endorsement they are talking about. I think you talk about the endorsement. They say before they allocate, they have to endorse. Did they tell you earlier about the endorsement? Also, concerned about the letter, they said they were not happy with the sentence of the letter. Did you insult them in that letter?
Okay, thank you so much, Mr. President and your team. My question will be, you made mention of something during your narration. You said when you started going back and forth with the ministry with regards to the payment of the allowance, and the ministry did not honor that happened because in most of the places where your staffs are, the offices are locked, or not? Just to confirm what you said, because this was also something that we had. The other question I wanted to add.
You can respond.
So I will answer maybe one or two questions, then the others can also answer. So regarding who is a member, right, and whether all the members are bona fide members, right? Yeah. So according to our constitution, anyone who is a graduate of any public health school in the world, whether it is Taiwan, whether it's China, Senegal, Gambia, I mean, you are to be a member of the association. Yeah. So that is it. So our members usually are graduates from School of Public Health, Gambia College, and School of Public Health, University of the Gambia. Yes. No.
To say that perhaps if you can give us time so that we shut, maybe let's say tomorrow, and then
if they need it,
able to liaise with the HR department so that we can able to establish those figures.
Yes.
We don't want to give you anything.
Yeah. Just like I said, you are on the oath. Whatsoever you answer, make sure you know it and let it be something.
Sure.
If you don't know anything, we'll give you the opportunity to maybe revert back and then get back to us. And please carry on.
Yeah, so the issue of endorsement, when we are being informed. So we were informed about these two endorsements during the second phase of the sit-down strike. To be precise, after the task force had a meeting with the minister, that was when, during this phase,
executive of the association by pointing out names that those people are the people igniting violence or trying to motivate members to act the way that by sitting down. Instead of us, we even wrote them back that we are not happy with the situation that they have done by going live on the press conference to even start mentioning names of people. Because we told them that the membership of the association is not only stopped at the Ministry of Health, but anybody who is a trained public health professional within or outside the Gambia. On the communication to membership that you made mention of, when the Congress was called, both first and second Congress, people came as far as Koina Health Center to Brikama to attend the Congress. And then after the Congress finished, the second Congress finished around 5. And it would have been very difficult for them to move that particular night to get to Koina. So we said for them to get back to Koina and there are various places, those within the Sarakunda are easy, but those within this, we receive signals that something is going on. The suspension has been evoked, like people have been suspended. For what? Did we ask for what? But Later, we received a letter that it is suspended because we could not, the association did not adhere to the permanent secretary's statement, which was actually something that we still could not understand. Amount, whilst public health brought down. And then responsibility allowance was also part of the request, because all other cadres are also having that particular allowance. And then to say the amount of money involved that we're talking about, we cannot, we as an organization or as an association, we don't have that data.
Mohammed Keta, the apology letter has something to do with the issue of harassment that you asked. But the association did not apologize to the ministry because we have offended them in any way. We the suspension is for 371 members. Yes. Right, an apology. Yes. Yeah, yes. Yes, I'm coming to that. Yeah, that's what I'm saying. In all our communications, we were very professional. Harass anyone, but we deemed it necessary to write an apology letter because we were assured that if this apology letter was written, the suspension was going to be rescinded. So, for the interest of the 371 2 months without salary, an apology letter is nothing compared to those people, their family livelihoods.
The reason why is in their submission, then he said apology was written.
Okay.
And since after then, he has not heard from the ministry.
Well, good afternoon to you all. I think, first of all, I would like to thank each and every one of you being part of this meeting, which is very, very important. I think if dialogue didn't solve anything, I don't think force can solve it. I think this is very important for us to interface so that we can know what has actually transpired before we just keep on moving in strict speculating things which are not true. So, and then, though I came late, but what I pick from your discussion is especially what this gentleman have had. And also you talking about specialty allowances and also responsibility allowances. I think these are the allowances and on-call allowances. I think these are the allowances that the public health officers are claiming that they should be paid. Like this payment of these allowances, are you talking about across all public health officers should be paid responsibility allowances, or only the desk officers?
If you are given responsibility,
no, the question that I'm asking, because if you said responsibility allowances, because to my understanding, if you said responsibility allowances, now you are talking of public health officers. Are you telling this gathering that you want all the public health officers in the country to be paid responsibility allowances and specialty allowances?
Is that the only case or you have another one?
Yes, that's my question. Yes, it's what I want to ask. Yes. Okay. Okay. Well, yes, this is the question that I want to ask. Is it that like payment of these allowances, like do they want all the public health officers to be paid allowances and then specialty allowances? But I know for risk allowance, that one is a matter of must. All of them must be paid risk allowances. But for specialty allowances and then responsibility allowances and on-call allowances, these are the allowances. Personally, me, I have an issue. Yes.
Because outbreaks of outbreak. So when people went for strike, anything could happen within that period. Yeah. I'm sorry for my voice, I had it. I've seen a terrible accident on my way coming. So, I'm sorry. Yeah.
So, and he's talking about other ways of engaging. Okay. Madam Bala, please. Yes.
Thank you very much, President and the team.
This is a very unfortunate scenario, but going through, I've realized that words were not kept. The authority, according to your deliberation, did not keep their words. And you people did not have regard and respect for authority. And that have put the Gambian children under hostage. And the president go further to say, why are they putting the Gambian children under hostage? Why this hostage? It is the you giving the service is striking, but not the service. Because if in my own area, my people were denied with the common infant welfare card.
At 2 a.m. in the night. I mean, a SIP can we have porous borders. So that is why those